Your doctor told you that you have chronic pain and gave you a prescription for duloxetine. You wonder, what is this medication? You heard that this is an antidepressant, but why do you need an antidepressant to treat pain? Today, I'll answer some common questions that patients ask me when I give them a prescription for duloxetine. How does it work? What kind of pain is duloxetine used for? When will it start working? Can duloxetine cause weight gain? Is duloxetine better than other painkillers? Can people get addicted to duloxetine? Will it help me sleep? My pharmacist told me that I need to stop smoking if I want to take duloxetine. Is that true? Can I take duloxetine if I'm taking another medication for depression? So let's talk about duloxetine today. How does duloxetine work? Duloxetine works by increasing the neurotransmitters in the brain, serotonin and noradrenaline. These two neurotransmitters are important in some parts of the brain to fight the pain. I explained this in another video, what is chronic pain. That this is a disease of the pain system, and when the pain system is malfunctioning, it is like the alarm system of a house that is too loud, or there are false alarms, or the alarm is going off all the time, constant buzzing in your head. Chronic pain is like that. The pain sensors are oversensitive, the volume is increased and there are false alarms, and this happens all the time, 24 hours a day. One way to fix the pain system is by regulating the neurotransmitters in the brain. There are many other ways to fix the pain system, and you probably have heard me talking about the toolbox of 5 MIS. You should have many tools in your toolbox to fix your pain system. Medication is only one of the tools, it's one of the M's. Number 2, what kind of pain is duloxetine used for? Duloxetine has been approved for neuropathic pain that is caused by diabetes. We call this painful diabetic neuropathy. Symptoms may include burning, tingling, numbness in both feet and hands. So because duloxetine treats neuropathic pain from diabetes, we use it off-label for other types of neuropathic pains. You may also want to learn more about neuropathic pain. I have another video about that. I'll put the link in the description below. Some examples of neuropathic pain includes herpes zoster, postherpetic neuralgia, multiple sclerosis, radiculopathy, like cervical or lumbar radiculopathy, or pain after spinal cord injury or stroke. Duloxetine has also been approved for people with fibromyalgia, and it's especially good for them because fibromyalgia is a condition that usually shows signs of depression and anxiety. And because duloxetine is an antidepressant, it will help both the pain and the mood problem. Duloxetine also has been approved for chronic low back pain and osteoarthritis of the knee. I particularly do not use duloxetine for these conditions. I find that my patients report better pain relief with other interventions like exercises and injections. But there are some cases of chronic back pain and knee pain that do not resolve with exercises and injections, and they have some components of nerve injury around the back or the knee. For example, if they had a previous surgery to the knee or to the back, then there were nerves that were cut by the surgeon and so that might be resulting in some neuropathic pain. Now, I always explain to my patients that they should not expect duloxetine to eliminate their pains completely. That is an unrealistic goal. If they think that this pill or any painkiller completely eliminates chronic pain, then they will be disappointed. I tell them that we expect the pain to get at least 30% better. That's why it's important to measure the pain intensity and function before we start duloxetine. So, the next question that I usually get is, when it will start working? Let me remind you, before I continue, this video is not intended to replace medical advice. It is for educational purposes only. You should contact your doctor for a proper diagnosis and treatment plan for you. And in case of emergency, go to the nearest emergency department or call an ambulance. Well, duloxetine will take some time to start working. It has to be taken every day, and it will slowly increase the neurotransmitters in the pain system. We don't want to give a high dose to start, and this is to let your body to get used to this medication. Initially, there might be some side effects, and these side effects may include nausea, dry mouth, dizziness, constipation, fatigue, and in some people, they will get too sleepy, and in others, they will have insomnia. But these side effects are dose dependent, which means they are more severe with higher doses. So if I give you a higher dose to start, you may have severe side effects right away and will abandon this treatment. That's why we start with a lower dose, and the lowest capsule contains 30 milligrams. Then we start increasing to 60 milligrams and then 90 milligrams. To have results for pain relief, we don't need to go higher than 90 milligrams a day. Then the body gets accustomed to the side effects and you don't have them anymore. But you need to take the duloxetine for at least 4 weeks to notice the 30% pain relief. Can duloxetine cause weight gain? Duloxetine has very minimal effects on weight. And remember, if you know someone who takes duloxetine and you'd like to send this video to them, just press the share button below. Another question, is duloxetine better than other painkillers? Well, duloxetine is not a painkiller, it's an antidepressant medication. It is also used to treat major depressive disorder and generalized anxiety disorder. We may use duloxetine combined with other painkillers and other anticonvulsant medications if we want to treat pain. Well, can people get addicted to duloxetine? The short answer is no. Duloxetine is not a medication that leads to addiction. However, because some people get sleepy with this medication, there might be some abuse of duloxetine, which leads to the next question. Will duloxetine help me sleep? It is interesting that this is unpredictable. We tell the patient who never used duloxetine to take at night and once a day before bedtime, because it usually causes sleepiness. However, I inform the patient that in some people it will cause insomnia. It's activating. And if this is their case, they can switch. Instead of taking at night, they can take in the morning. My pharmacist told me that I need to stop smoking if I take duloxetine. Is that true? No, you don't need to stop smoking. However, we know that smoking cigarettes leads to some changes in how your liver uses duloxetine. So people who smoke may need a higher dose of duloxetine to get the same benefits than a non-smoker. Can I take duloxetine if I'm taking another medication for depression? Well, that has to be discussed with your doctor and your pharmacist. There are a variety of individual situations and each one is different. So the answer is, it depends on your case. That's all that I had for today. I hope I answered all of your questions about duloxetine. If you like this video, don't forget to like it and press the thumbs up here, and don't forget to subscribe to this channel and turn on the notifications and watch my next video here. Thank you for watching today. Goodbye.